Please break it down even further so that we know the areas to go to and where not to walk and all that. Sometimes some of them are actually asking, if we're going to look at the data, does it speak of, you know, the women who are actually the ones who are infected more, or the men, you know, specific areas perhaps, you know, that people should look out for and be careful? Actually, in the data we presented, 53% of the clients we see total are men. Okay. While 47 were women. Now, it is a reverse if we went to the PCR. PCR, women were higher than the men. Okay. But about the location of where to walk to or not to walk to, it might not be easy to tell. Just be careful. The only thing is be careful. Right. Come to the clinic, let us test. If it is there, let us treat to break the chain of transmission so that you are sure of your status as you're outside there. Okay. But telling you that don't walk there, how about if you're the one having the STI? That's true. Yeah. Okay. So you're saying PCR at that level, that is now at a higher level, it is the women that were most. Yeah. What informs this? Just to enlighten us, or perhaps remind us of some of the things that we learned about, you know, some time back when we're learning about this, that some of these symptoms are manifested faster and more in men than women, or what exactly? There are some specific infections which affects women more and some affects men more. Okay. But why are women more affected than men? In the surface area of our reproductive system. Okay. So they have a larger surface area compared to men. That's why you will get, for most of these infections, women will be more affected than men are affected. Okay. That's basically the biggest difference which is there. Yeah. All right, that's great. What does it speak about now, the levels of HIV in some of these areas that we're talking about, perhaps in Nairobi and Mathare for that matter, if you're going to tally the same with the STDs that we have talked about? I might not have a specific distribution, HIV transmission distribution as per gender in Nairobi or in Mathare as at now. Okay. Maybe that if it's looked at, maybe it can be shared. All right. Okay, so if you're going to talk to the people today, what will be this one thing that you tell them they need to do, because it's critical that then we are alert, we stay woke, and we get to understand the best ways to move. And know in the process of this discussion, we have as well highlighted some of those, but what would it take for us to change this to being a lower number? Basically, what I can tell the people now is that let us get tested, let us know our STI status, let us get the appropriate treatment after testing. Okay. Because I might get tested but don't get appropriate treatment. Okay. Then the health education which is being given, let us break the chain of stigma at the community level. And to the healthcare workers and the health facilities, I would say let's make our services friendly, confidential, and non-discriminatory. Okay. Because basically, if we discriminate and our services are not confidential, basically, no one will walk in. So we test, we treat, then we spread the information. Okay. Let's be the ambassador of change. All of us to be the ambassadors of change. Let's not say it is the work of healthcare workers, it's the work of the public health officers to do the health education. Health education is the role of each and everyone. Because if I talk to my friends and they are helped, the society is helped. Okay. So if I say I have to wait for a public health officer to come and give the information I can give it, we'll not be able to help in that. All right. As well as we say as AHF Kenya, our services are free. We offer free services. Right. So our gates are open, our doors are open. Walk in, come, get tested, and get treated for STIs. And Gladys, I am glad that we're talking about testing and all that. It reminds me of some time, should be early this year, when there were, cases or fears that the HIV and AIDS test kits were not, in the best of shape, in that, of course, even the results they would give were a bit faulty or a bit off. Just how many times should one test or be screened to confirm that indeed